Okay, let's unpack this. Could something as seemingly simple as conscious, expressive movement, dancing, actually be a form of medicine?
It challenges our usual way of thinking, doesn't it?
Totally. Not just for fitness or stress relief, I mean, but in a tangible way that impacts health and healing.
Exactly. We often see medicine in terms of, pills or procedures.
Right.
But the material you've shared for this deep dive, it makes a really powerful case that our bodies, minds, and health are profoundly connected.
And that movement can be a potent therapeutic tool in actual healthcare settings.
That's the core idea. We're diving deep into the world of dance movement therapy, or DMT, specifically how it's applied in medical contexts.
Yeah, and this isn't about learning specific dance steps, right? It's more fundamental.
It's about accessing the body's natural language, its capacity for expression, as a kind of pathway for healing.
So our mission here is to pull out the key insights, the really compelling examples, and the core findings from this source.
It gives you a real understanding of how movement, psychology, and even biology all weave together in this field.
Consider this your shortcut into medical DMT. Let's get into it.
No.
So one of the first things this source really emphasizes is this fundamental shift in how we even think about health.
Exactly. For a long, long time, medicine tended towards a very mechanical view, like a machine.
A single cause view, sort of. If something's broken, you fix that one part.
Right. The source called this formistic or mechanistic thinking.
Like you have a bacterial infection, you take an antibiotic, infection gone, problem solved. One cause, one effect. Simple.
Precisely. But illness and health, well, they're just far more complex than that, aren't they?
Seems so.
And the research, it increasingly points towards a biopsychosocial model and systems thinking.
Okay. Biopsychosocial. So biopsychosocial. Biology, mind, social context.
Exactly. Understanding health is contextual, meaning it has multiple causes, and organistic.
Organistic.
Yeah, where different factors interact, and something new emerges from that interaction.
Yeah.
It's about and thinking, not just either or.
So it's not just the virus, say. It's also your stress levels, your support system, your environment, maybe even how you perceive the illness.
Yeah,
All of it interacting.
you got it. Everything working together. And this thinking leads to what the source calls one of the most critical distinctions in this whole area.
Which is?
Disease versus illness.
Yeah.
And, relatedly, curing versus healing.
Ah, yes. This is where it gets really interesting, I thought. Disease is the biological thing, the pathology, doctor diagnoses, right?
Right. Disease is about that identifiable biological change. It's the target for medical eradication or management.
Okay.
But illness. Illness is the patient's subjective experience, how they feel,
Yeah.
their sense of wholeness or, lack thereof.
And curing is about getting rid of the disease itself,
Mm.
while healing is about restoring that sense of wholeness, addressing the illness experience.
Yes. And the really key insight here is that healing can happen even when curing isn't possible.
That's huge.
It is. The source shares this powerful example, a patient with cystic fibrosis, a condition with no known cure, right?
Right.
When introduced to DMT, he kind of got it. He understood the focus was on healing, and he actually said, since there's no cure, we may as well work on healing.
Okay, makes sense. But
Then, after a session, movement, relaxation, imagery,
yeah.
he felt so profoundly different, so much better, that he told his nurse, she cured my CF.
Wow. Just wow.
For him, that shift in how he felt, that restoration of some sense of well-being, was a cure in his experience, even though the underlying biology hadn't changed.
That just perfectly highlights the patient's perspective, doesn't it? And the power of addressing that subjective illness.
It really does, and this is exactly where the arts, including dance, fit into a medical context.
Okay.
This source suggests that engaging in arts, like dance, can be a way to reclaim our sort of innate conscious dance, our natural capacity for expressive movement.
And that's connected to authenticity, to health.
Deeply connected, the source argues. It's more than just a distraction or a nice add-on. It's tapping into something fundamental about being human.
Okay.
And there's this growing field called arts medicine. It's broader than arts therapies, but related.
What does arts medicine cover?
Well, it explores all sorts of intersections between arts and healthcare. Things like the artistic lives of doctors and nurses, how art depicts medical history, the aesthetics of healing environments.
Oh, interesting. Like how a hospital looks and feels.
Yeah. And art created by patients, and of course arts-based services like dance movement therapy. There are even organizations like the International Arts Medicine Association pushing this forward.
It really seems like accepting this broader biopsychosocial model and that difference between curing and healing It's kind of essential before you can even appreciate what DMT might offer in medicine.
Absolutely. It's the foundation. And once you grasp that shift, you can really start to see the deep mind-body connection that DMT works with.
Right, and the placebo effect is maybe the most famous or infamous example of that connection.
It is. The source defines it pretty standardly, desirable effects from inert treatments. But the real insight comes when you kind of unpack it.
It's not just passive belief.
Not at all.
Mhm.
It involves the patient's own beliefs and expectations, sure, but also the clinician's suggestion, the quality of that relationship between patient and provider,
Okay.
and even just a reduction in the patient's anxiety. It's complex.
And they prefer the term meaning response, which I liked.
Yes, and for good reason.
Hey.
It feels more powerful because it attributes the physiological or psychological effects to the meaning that's inherent in the whole treatment context.
The meaning and the beliefs, the relationship, the ritual itself.
Exactly. So if healing is tied to meaning and belief and relationship, then these psychosocial factors, these mind-body dynamics, they aren't just secondary things. They're absolutely central to the healing process.
Makes perfect sense. And speaking of mind-body dynamics, stress is obviously a huge player here. We all know chronic stress is bad for health.
Right. It's well established. Groups facing chronic stressors, think caregivers, or people living in poverty, they're at measurable health risk.
And the source links this back to our basic biology.
Yeah, back to our ancient fight-or-flight system,
Right.
driven by the sympathetic nervous system, the SNS.
Getting the body revved up, ready to run or fight, adrenaline, cortisol.
Exactly. Those stress hormones flood the system. And there are direct neural links between the parts of the brain processing emotion, like the limbic system, and the stress response hubs.
And this system talks directly to the immune system. That's key.
Absolutely key. It's a two-way street, actually. Stress hormones can affect immune cells, sometimes suppressing function,
Okay.
and immune messengers, these things called cytokines, they can actually travel back to the brain and influence the stress axis itself.
Wow. So the immune system and the nervous system are constantly communicating.
They are. But the crucial point for movement therapies is what happens when that fight-or-flight energy gets activated, but then it has nowhere to go. You're stressed at your desk, you can't run, you can't fight.
It just gets stuck in the body, like
Uh,
tension.
Precisely. That thwarted physical reaction, that buildup, can contribute to chronic muscle tension, maybe other physical problems down the line.
Oh, okay.
And the source highlights how physical activity, including expressive dancing, can actually help use up those accumulated stress chemicals.
It completes the biological cycle in a way.
That's the idea. It allows the body's counter system, the relaxation response, the parasympathetic nervous system, or PNS, to take over and restore balance, homeostasis.
That's a really powerful insight. Movement isn't just exercise in this context. It's a way the body naturally processes and clears stress chemicals.
It seems to be a core mechanism. And while stress's negative effects are pretty clear, the source also touches on the potential of positive states, which is interesting.
Oh, yeah?
There was this fascinating study using method actors. They had them genuinely induce different moods, anxiety, depression, happiness, neutral.
Okay, and they measured immune changes.
Yeah, specific immune cells, like T cells and NK cells. And interestingly, both of the high arousal states, anxiety and happiness, showed more immune variability compared to the lower arousal states of depression or neutral.
Huh. So it wasn't just positive versus negative, but the level of arousal itself mattered, at least in that study.
In that specific context, yeah, it's just arousal might be a factor, not just the emotional valence. Definitely needs more research, but it's an intriguing finding.
Very. The source also talks a lot about imagery, calling it the interface between mind and body.
It's presented as a really key concept, how patients internally picture their illness, their body, their treatment. It seems to have a real impact.
Like when patients use metaphors. You mentioned gout feeling like matches, or MS distorting their sense of space.
Exactly. That's their internal body image being expressed. And then there was that image CA study with cancer patients. That sounds almost unbelievable.
Tell me about that one again.
It's remarkable. Patients drew pictures, images of their disease, their immune system fighting it, and their treatment working. Researchers then scored the symbolism in these drawings, not artistic skill, but the symbolic content.
And this imagery actually predicted outcomes.
Significantly, yes. With reportedly high certainty, the scores based on the type of imagery predicted which patients would go into remission versus those who had experienced marked deterioration.
What kind of imagery made a difference?
Things like strong, active, powerful imagery for the immune system, like big animals, warriors, white knights, that was associated with better prognosis. whereas weaker, more passive, or destructive imagery was linked to poorer outcomes.
Wow, that's pretty profound. What's the thinking behind how that works?
Well, the source links imagery to altered states of consciousness, things like deep relaxation, or the kinds of states people might reach in certain movement practices, like trance and dance rituals.
And these states might open things up.
The idea is they might open up neurological pathways for psychophysical change, making the mind-body system more receptive. This ties into something called state-dependent learning, memory, and behavior.
State-dependent learning.
Yeah, the idea that something you learn or experience in a particular state, whether it's a mood, a physical state, even a drug-induced state, is best recalled or accessed when you're back in that same state.
Okay, so that applies to trauma triggers, right? Something reminds you, puts you back in that state.
Exactly. But it also works for positive states. If you learn or deeply realize something positive, like a feeling of self-efficacy, congruence, peacefulness, while in a specific state, like deep relaxation or a certain feeling in movement,
Then getting back into that state helps you access that positive feeling or realization again.
that's the principle. You can reinforce those positive states and make them more accessible later on.
And the source even notes that imagined movement is linked to brain activity.
Yes. Things like EEG show brain activity changes, even when someone just vividly imagines moving. It suggests a really deep connection there. The research on full-body movement and brain activity is harder, technically, but the link between imagined movement and the brain is pretty well established.
So this mind-body connection, it's not just some vague idea. It seems grounded in physiology, hormones, the immune system, the power of imagery, and even how our brains process movement, whether it's real or just imagined.
Absolutely. Which is the perfect lead-in to how movement itself becomes a kind of therapeutic language.
The source uses the phrase, the body embodies experience.
Yeah, and it talks about this integrated cycle: thought, feeling, sensation, and action. Our experiences, especially stress or trauma, often get held in the body as physical sensations, tensions, postures.
Right.
The genius of DMT, according to the source, is that it often enters this cycle at the sensorimotor level. That means starting with sensation and perception through movement.
So instead of just talking about feeling anxious, you might start by exploring the physical sensation of anxiety, the tightness in your chest, the shallow breathing through movement.
Precisely. Working directly with that sensation and movement, it naturally leads you to explore the associated emotions, the imagery that comes up, the related thoughts or behaviors.
And that makes it different from standard talk therapy.
Very different in its primary mode. It's also distinct from passive therapies like massage, where the patient isn't actively initiating, or from sequence-based practices like yoga or qigong, where you follow the instructor's lead.
Because in DMT, it's the patient's own movement, their unique expression that becomes the focus.
Exactly. Their spontaneous or guided expressive initiations become the content of the therapy, often in an interactive, improvisational way with the therapist.
And this ties back to releasing that pent-up stress and tension we talked about earlier.
It does. Allowing the body to finally express those thwarted physical reactions to stress or trauma, but doing it through movement in a safe therapeutic space. It helps discharge those chemicals and integrate the experience.
And using that state-dependent learning idea again, if you practice coping with difficult physical or emotional states through movement in therapy.
The idea is you become better equipped to handle them outside of therapy. You enhance the body's ability to regulate itself, to find homeostasis, to feel competent.
Okay, so where is this actually being applied in medicine? The source gives quite a few examples.
It covers a lot of ground, and one of the core areas identified is chronic pain.
Which makes sense, given the mind-body links.
Definitely. The source mentions the neuromatrix theory of pain.
Which says pain isn't just a signal from damaged tissue.
It's much more complex. It views pain as something the brain constructs based on a whole matrix of inputs: sensory, cognitive, emotional, environmental. It's the body self neuromatrix.
So our thoughts and feelings about the pain actually influence the pain itself.
Critically so. This is why psychosocial factors are so relevant to pain perception and management.
And DMT seems really well suited to address those factors.
Absolutely. There's some great clinical examples in the source. Susan Imus, who founded a pain program, described a kind of generalized movement profile she saw in pain, patients often stuck, difficulty sustaining effort, a kind of run-stop-go quality.
And she used movement to work with that.
Yeah, like using water therapy for drifting, teaching slow movement to help them find sustained, free-flowing effort.
There was a boxer example too, right?
Yes, a former boxer with chronic pain, apparently suicidal. They used the structure of Tai Chi first to give him a sense of control,
Okay.
but then moved into improvisations, helping him find free flow. And the outcome was amazing. He generalized that feeling of mastery over his body, a movement to his life, and reportedly was no longer suicidal.
Incredible. Healing the suffering, even if the pain source wasn't gone.
Exactly. And there's other work mentioned, like Corinne Thulin working with a woman with rheumatoid arthritis.
Mm.
She had alexithymia, difficulty identifying or describing emotions.
Ah,
The therapist guided her to move inside her pain, to harmonize her breath and movement, which actually increased her range of motion. But it was also a psychotherapeutic process, exploring emotions through movement.
and the result?
Again, not curing the RA,
Huh.
but alleviating the illness. The patient reported a higher pain threshold, feeling stronger, more in control. Observed changes included decreased muscle tension and increased movement variety and joint mobility.
It really drives home that point. Chronic conditions might persist, but the suffering, the pain, the tension, the feeling of limitation that can be ameliorated.
Precisely. Healing is possible.
What about other stress-related conditions, like GI or skin disorders?
Yes, Lindy Dale's work is highlighted there. Conditions like colitis or eczema are often linked to stress.
How does DMT approach those?
Often starts right at the body level, asking the patient to show me how that feels through movement, exploring the quality of the sensation, how tightly. Can you exaggerate it? Is there a feeling connected to that tightness?
So connecting the physical symptom to an inner state.
Yeah, and sometimes using a developmental approach, asking, how old do you feel right now? This can help reframe childhood experiences linked to the physical emotional pattern,
And the goal is?
to integrate that physical emotional connection, and crucially, to teach symptom reduction techniques through body awareness and movement, but without reinforcing guilt or the idea that they somehow caused their illness by being stressed. It's about building coping skills.
Okay, let's shift to cardiopulmonary conditions. Heart disease, lung disease.
Right. With heart disease, the psychosocial factors are well-known, things like type A behavior, loneliness, depression, relationship quality, optimism. They all play a role.
And the heart is such a powerful symbol too, right? Not just an organ.
Exactly. The source mentions using DMT for stress management, exploring spatial awareness, passivity, finding ways to express anger safely through movement. There's a potential link to improving heart rate and blood pressure variability, maybe using techniques like Barton-F fundamentals.
There was a touching vignette about a support group.
Yes, where a wife was physically supporting her husband during a movement exercise, and then the whole group joined in, offering physical support. The source noted, no need for words, responded on a movement level. Powerful, nonverbal connection.
And the idea of effort without distress.
Yeah, the suggestion that DMT in cardiac rehab could help condition the heart muscle through carefully modulated effort, but without triggering the harmful stress hormones associated with distress.
What about pulmonary conditions like asthma or COPD?
Well, COPD is chronic, so needs long-term strategies. Exercise helps. For asthma, relaxation is key. Studies show it can reduce frequency and intensity of attacks. Hypnosis also shows benefits. DMT could integrate relaxation and appropriate movement.
Moving into HIV/AIDS.
The source notes that psychosocial factors like optimism, personal control, and finding meaning seem to buffer against disease progression. While there wasn't a ton of DMT-specific literature cited, pilot studies and theses explored things like group support, emotional expression, identity, and quality of life.
Okay. Now, neurological conditions, particularly in older adults. There was a strong study mentioned there.
Yes, Burrell and colleagues did a significant outcome study with older adults who'd had strokes, traumatic brain injuries, or aneurysms.
And what did they find?
Really positive changes in the DMT group compared to a control group. Significant improvements in cognitive performance, things like decision-making, clarity of expression, short-term memory.
Wow, cognitive effects.
Yes. And also in social interaction, more self-initiation, more ease in groups, setting goals, accepting invitations, and even specific physical improvements, like walking backwards or sideways and reaching.
That's quite comprehensive. Suggests DMT can impact multiple domains after neurological injury.
It really does. A strong piece of evidence.
Now, shifting to pediatrics. This seemed like a really rich area in the source material.
It is, and the absolute key here is considering the child's developmental level. How they understand illness changes dramatically as they grow.
PO stages, like little kids think illness is magic or punishment.
Exactly. Pre-operational kids might think it's contagious magic or because they were bad. Concrete operational kids start understanding internal-external causes. Formal Operational teens grasp multiple causes and ambiguity.
And their fears change, too.
Definitely. Young kids often fear pain and mutilation. School-age kids fear loss of control or competence. Teens fear loss of independence, identity, peer group changes. DMT has to be tailored to these developmental realities.
Nicholas Kasavak's work came up again here in pediatric pain.
Yes, he noted kids often arrive anxious, defended, maybe frightened of touch. So he integrates massage skills with DMT-LMA-KMAP using sensitive touch, adjusting spatial distance to create safety before even getting into more expressive work. It's about meeting the child where they are non-verbally.
KMP, what's that?
Kestenberg movement profile. It's another system for observing and analyzing movement qualities, often used with developmental work.
Got it. What about pediatric asthma?
Maury Rutter's work at National Jewish Hospital was highlighted. Asthma is serious, adherence to treatment is vital, and emotions often provoke episodes.
So the family is key.
Crucial. Parents are often included in sessions. Separation issues can be a theme, parents being overprotective or maybe detached. Mirroring activities in parent-child DMT can help explore that relationship non-verbally.
And for teens with asthma.
Group work often focuses on themes like anger about the illness, body control issues. They might create group movement sequences, use props for balance challenges, teamwork. Dealing with the stigma of side effects, like from steroids, is also important, finding belonging in the group.
The source also mentioned work in the Pediatric Intensive Care Unit, the PICU.
Yes, Kasavak again, working with very young, sometimes pre-verbal children, maybe post-transplant. Here, nonverbal observation skills like LMA and KMP are critical for perceiving the child's emotional state, needs, and coping mechanisms.
There was an infant case study.
Yeah, an infant with cardiomyopathy. Using KMP assessments before and after intervention showed improvements in psychomotor functioning, like balance and organization, reaching these very young, very ill children nonverbally.
And pediatric rehabilitation. That brings us back to the case of Thomas.
Yes, Thomas. Down syndrome, immune disorder, hemorrhages, autistic traits, hyperactivity, failure to thrive, hypersensitivity, nonverbal. Just multiple complex medical issues.
And DMT's role there.
It highlights DMT's capacity for teaching basic relationship skills, turn-taking, shared attention, nonverbal communication, and importantly, finding enjoyment and connection to the body, even with severe limitations. Building relationship through movement.
In his end-of-life experience, you mentioned that earlier, the sensorimotor life review.
Right. Even as his physical patterns fragmented, he briefly revived old, familiar movement patterns from therapy reaching out, rhythmic sounds. It was seen as a way of remembering, reviewing his life at a sensorimotor level, finding moments of connection, and perhaps even joy right at the end. Incredibly moving.
It really is.
Yeah.
Okay, let's talk about pediatric oncology, cancer in children.
Right. Thankfully, survival rates have increased, meaning more adult survivors carry the experience of childhood cancer. But cancer is described as a complex of stressors.
Impacting the whole family system over time.
Exactly. So the focus is often on psychosocial and developmental adjustment. And DMT offers unique ways to help kids express difficult emotions, anger, fear, loss, but also positive ones like joy, hope, and finding a sense of wholeness amidst it all.
Fantasy play seems important here too.
Very. Using symbolism and metaphor through movement and play allows kids to approach threatening situations indirectly. And for adolescents, body image issues related to treatment side effects are a huge concern that movement can address.
The source gave some really concrete group examples.
Yes, like naming and showing the feelings. Kids pick cards with feelings about cancer, then create body sculptures or statues, angry, sad, mad at God, praying. The movement then leads into verbal discussion.
And the cancer monster.
Yeah, drawing it, talking about it, and then physically expressing feelings towards it. Punches, kicks, shouts, maybe throwing foam balls at the drawing to wreck it and then throwing the picture away. Very cathartic.
There was also a psychoeducational one.
A cancer dance drama, teaching kids simply about white blood cells, tumors, treatments, and then having them enact two versions of the story. One where cancer wins, one where the person is cured. This allows space for everyone's experience and fears.
And the obstacle course.
Cancer in the family obstacle course. Using props and movement sequences to embody different feelings and experiences related to having cancer or having a sick family member finding out, feeling sad, worrying, scared, alone, angry, having extra chores, makes it tangible.
It sounds incredibly creative and sensitive.
It really highlights how movement can access and process experiences that words alone might not reach. especially for kids.
And we touched on this, but illness obviously impacts the whole family. What about specific support for parents and siblings?
Yes, systems theory predicts that. The source described DMT support sessions specifically for parents of seriously ill children.
What are the goals there?
Tension release, promoting self-care, providing a space for their own emotional expression, enhancing nonverbal communication skills, since they're often experts at reading their child's cues, and importantly, feeling witnessed by other parents going through similar things.
How does that look in practice?
Maybe finding a personal movement phrase, representing what they feel or need right then, exploring it with eyes closed. Then the group might join in or reflect the movement, offering nonverbal affirmation. Examples given were swaying, rocking, like holding an infant, arms up in prayer, or one parent embodying playing baseball then crying, representing their son.
Powerful. And siblings, they often get lost in the shuffle.
They do. They need emotional support, information, practical help, and help understanding their own reactions. They experience disequilibrium, fear, sadness, isolation, sometimes jealousy or confusion.
So how can DMT help them?
A multi-family group example was given for families dealing with asthma. They used an adapted movement choir format. How do you feel right now? Each person shares a simple movement phrase. The group learns it. It led to laughter, shared emotion, and opened up verbal discussion about anger and frustration.
There was a family sculpture task, too.
Yeah, drawing family members, identifying loved qualities or ways they offer support, then making sculptures embodying those characteristics. The therapist might model one like a belly laugh.
And the partner stretch.
The sibling partner stretch seems really key. Sitting back to back, practicing leaning into each other for support, sensing each other's weight and needs, physically embodying mutual support with verbal encouragement, practicing giving and receiving care.
That seems applicable beyond illness, too, just for family connection.
Absolutely.
Okay, moving towards the end of life, hospice care and bereavement.
Linny Dale's work in hospice was mentioned again. Here, movement observation becomes critical, especially when patients can no longer speak. Even subtle shifts in posture, gesture, muscle tension can signal comfort, distress, or unresolved issues.
So the nonverbal channel is primary.
It's often the only channel, and the therapist uses body empathy, reflecting the patient's posture, gestures, movement dynamics, not just to understand, but to connect, to mitigate the profound isolation and fear that can accompany dying. It humanizes the process.
Creating connection through shared physical presence.
Yes. It's described as having an intimate quality, creating a sense of more time and connection despite the reality of limited time. Honoring the life that remains, seeing the patient as a gift.
And for terminally ill children.
Kinesthetic empathy is central. Children rely on their bodies for expression and catharsis, and that's compromised when the body is failing. Identity and attachment are still developing. DMT aims to support them through the dying process, non-verbally.
Bereavement work also uses movement.
Yes. Murphy's view of grief as an opportunity for growth is cited rediscovering self, deepening intimacy, finding meaning beyond pain. Judith Bunny's work, honoring life's passages, helps people physically recall the loss through postures or movement phrases associated with the person.
Like embodying the absence.
Yes, and then using movement structures like looking back and moving forward, maybe walking diagonal or curving paths, representing the journey of grief, with the therapist sometimes walking alongside.
What about getting stuck in grief?
They might work with intensifying or exaggerating the stuck posture or movement to understand and transform it. Expressing anger is also key, using jumping, running, fighting elements from LMA.
C.S. Lewis quote about grief in the body.
Yes. Her absence is like the sky, spread over everything. But grief is like a long valley, a winding valley where any bend may reveal a totally new landscape. Sometimes the bereaved cries to God, "My legs are weary, my back aches." Grief resides physically.
And loss of shared touch is a big theme.
Huge. Especially for grieving spouses or partners. The example of a woman whose paralyzed husband could only communicate through touch, the loss of that specific physical connection was immense. Movement therapy can provide a space to explore that loss.
And for bereaved children.
Support groups provide continuity.
Yeah.
DMT can be integrated into multidisciplinary programs. That sibling partner stretch example comes up again, relevant for bereaved siblings learning to support each other through loss.
Finally, the source loops back to something fundamental: patient-provider communication.
Right, because nonverbal communication is fundamental to DMT, but also to any healthcare relationship. The source suggests adapting DMT concepts for training healthcare providers.
How so?
Well, things like patient-centered interviewing techniques actually resemble supportive therapy. Building trust is a process involving nonverbal cues, reciprocity, mutual intention. Active listening isn't just hearing words, it's reading the nonverbal channel.
Research shows providers aren't always great at this.
DiMatteo's work is cited, showing a relative lack of attention to nonverbal information in medical training. They might be taught to read patient cues, but not necessarily how to express empathy nonverbally themselves. One study filmed residents posing expressions, suggesting it wasn't a focus.
And that synchrony study you mentioned earlier.
Yes, the acupuncture and PCOS study, exploring nonverbal synchrony and echoing between the practitioner and patients, they found more echoing than perfect synchrony.
Meaning?
Initially, the doctor tended to echo the patient more, maybe building rapport. Later, the patterns equalized or even reversed, suggesting mutuality and patient trust had grown. The clinician adapted her style.
And the really intriguing part.
The correlation, not causal, small sample. But the same women whose nonverbal interaction patterns showed these shifts towards mutuality also had reproductive improvements.
Wow. So the quality of the nonverbal relationship might have physiological implications.
It's a powerful suggestion.
Yeah.
It definitely compels more research into that subtle nonverbal dance between patient and provider and its potential link to healing outcomes.
So researching all this must be challenging. Mind-body interventions are complex.
Extremely. Collaboration is key. Multidisciplinary teams. You need that organistic systems approach we talked about at the beginning. Mixed methods combining qualitative insights with quantitative data seem really effective, like in that PCOS study, the Burrell stroke study, Dibblehope's work.
What about case studies?
They're valuable, especially for complementary and alternative medicine or unique patient situations where treatments aren't easily isolated. They make treatment effects clear, but you need accumulated cases to generalize.
And measuring things physiologically during movement is tricky.
Yeah, full body movement makes things like EEG challenging. You also need to select relevant immunological measures and look at activity levels, not just raw numbers of cells. It's complex.
And training practitioners for this work.
Requires specialized training-specific coursework, personal movement exploration, understanding the medical context, building collegial relationships with healthcare teams.
The source mentioned some training exercises.
Yeah, things like exploring childhood movement memories for embodiment, dancing with imposed limitations to build empathy and find resources, creating a coping dance to embody strategies, breath exercises for body awareness. It's experiential.
This has been an incredible deep dive. It really paints a picture of how movement and the arts are far more than just nice extras in healthcare.
Absolutely. They seem to address fundamental aspects of the human experience of illness, suffering, and healing.
We've gone from that basic shift away from a purely mechanical view of health
To the biopsychosocial model, understanding the profound mind-body connection through stress, immunity, imagery.
and seeing how movement itself acts as a language for expression, for coping, for building connection.
Yeah, and we saw how medical DMT applies these principles across such a wide range of conditions and populations, managing chronic pain, coping with serious illness, supporting children and families through health crises, even finding meaning and connection at the end of life.
It's such a powerful reminder that healing isn't solely about the absence of disease, is it?
No, it's so much about the presence of wholeness, resilience, and that essential human connection, even when cure isn't on the table.
Her sources mentioned that idea that everyone's life is dance, inherent even down to a cellular level.
But then most of us have forgotten this, forgotten consciously how to dance.
So here's a final thought. What if reclaiming that conscious connection to our body's innate capacity for movement and expression isn't just an interesting therapy for specific problems?
But maybe something more fundamental, a frequently overlooked element of what it actually means to live fully and maybe even to heal.
Definitely something to think about.